Welcome to the Primary Care Fund Annual Application Review for fiscal year 24-25. My name is Tracy Gonzalez with the Department of Healthcare Policy and Financing, which you'll also hear referred to as HICPUF throughout this presentation, and I am your point of contact for the Primary Care Fund program. Today's presentation will include an in-depth overview of the Primary Care Fund application, data validation updates and common audit findings, and the funding of the Primary Care Fund program. Applications are housed on the SharePoint platform, which is an external sharing site. Each clinic has their own SharePoint homepage, and the application for fiscal year 24-25 was released on January 29th. It can be found in your SharePoint platform in a folder labeled 24-25. All of your historical applications and supporting documentation are also housed on your SharePoint profile page. I think this is extremely helpful if you are brand new to filling out the application. If you have come across anything that you're unsure of, you can go back to your previous year's application and take a look at how certain questions were answered or what documentation was uploaded. Each clinic must have a registered user to access their SharePoint. If you need to request access, please email the Primary Care Fund email address with the organization name, the individual who you need access for, and their email address. Applications are in an Excel format. It is an Excel workbook that consists of a total of 27 tabs. We have found that there were some issues with being able to see the entire content of certain cells when you open the application from the SharePoint platform. So I do recommend instead opening it in the desktop app. You can do that by clicking up on the viewing option in your toolbar. You'll have 3 different options: editing, viewing, and then the third choice is open in desktop app. This will open up in a new tab, and it should eliminate those issues with not being able to see the entire wording within certain cells. But the other good thing is that this will keep automatically saving to your SharePoint platform. So you do not need to continually go up in the upper left-hand corner and click save every time you walk away from your application. It is automatically saving to SharePoint. Now, you do have the option of downloading the application to your computer desktop. If you do decide to go that route, just remember that when you're ready to submit your application, you must then upload your workbook back to your SharePoint profile page. So there are a couple options there on accessing the application. We'll be going through the application tab by tab. I have included screenshots throughout the application so that you can see where we are at and kind of follow along. So the first tab that you will come across is the table of contents. That is self-explanatory. It is just an introduction to the application and what each tab includes. The next tab is your introduction tab. The introduction tab has the history of the Primary Care Fund as well as the purpose. We've also included the link to the Code of Colorado Rules and Regulations for you. I think this is a great link for you to bookmark, share it with any new employees that are coming on board, and this is the first time they're working with the Primary Care Fund program. They're able to click within this link and take a look at the rules and regulations of the program. I think it's a good introduction for any new employee. The next tab is the definition tab. This includes terminology and definitions to assist in understanding the language that is used within the application. The application timeline tab has the timeline of the application. The next deliverable that is due from the applicant agencies is your intent to apply notification. That is due by Friday, April 12th. please submit your intent to apply via the primary care fund email address. Include your organization's name as well as the primary and secondary contact for your organization and their email address. And then the application responses are due by close of business on Friday, May 24th. And tentative award notifications will go out Monday, July 8th. The next two tabs are your instructions tab and your checklist tab. The instruction tab just goes through the instructions of how to submit your application to SharePoint. We do ask that you keep it in the Excel workbook format. Please do not try to convert it to PDF or upload or insert anything into the workbook tabs. And as a reminder, please keep all documentation for 5 years. And again, the link to the Colorado Code of Rules and Regulations is there. And a disclaimer that any documentation submitted during the application response period becomes the property of the state of Colorado. The next tab is the checklist tab. And I think this is extremely helpful, again, if you're new to filling out the application. This will just give you the tasks that you must complete, and you can keep track of them by checking yes or no. The agency information tab requires you to input your legal name, the business name of your agency, the federal employer identification number, the legal address and mailing address if it differs from the legal address, the name of your primary and secondary contact person, as well as their position, title, phone number, and email addresses. In the upper right-hand corner are a set of 3 checkboxes. The first checkbox is as to whether or not you are a federally qualified health center. We do not require you to upload any documentation to support that. We do verify that internally. The next checkbox is whether or not you are a corporation, partnership, or other. And the last set of checkboxes is your certifications and licenses. Please make sure that the expiration date is listed on the application and that those certificates are uploaded to SharePoint and that they have the duration of the accreditation clearly stated on them. Then down at the bottom of the agency information tab is your average cost per visit. We do not have a required formula that you use. We have included the UDS medical cost per medical visit formula if you choose to use that. But again, however you calculate your average cost per visit is up to you. But we do need the average cost per visit listed, the type of cost, and a description of the cost per visit. The applicant history tab must be filled out by new applicants and clinics notified on February 2nd that they must fill out the entire application. The applicant history tab includes your agency's mission and the history of your agency. Question 1 is your patient count and the methodology used to come up with your medically indigent patient count. There are a few different steps to this, so we'll go through step by step, and then we'll come back to question 1 to review how to fill it out. The first step is determining your freeze date. Your freeze date acts as a point in time in which your data is fixed so that your count can be made. The patient's visit closest to your freeze date is the source designation used in the application. The unduplicated patient counts should be calculated on a specific point in time occurring between the end of the calendar year and prior to the submission of the application. So for fiscal year 24-25, your freeze date could be anywhere between December 31st, 2023, and the submission of the application, which is May 24th, 2024. So let's take a look at the unduplicated patient count and those patients that should not be included in your count. The unduplicated patient count is the sum of patients who have had at least one visit and received at least one of the services under the definition of comprehensive primary care during the applicable calendar year. Your patient count should not include counting patients more than once if the same patient returned for additional services, counting a patient more than once if the payment source designation changed during the applicable calendar year, counting those individuals who have only received services through an outreach event such as community education program, nurses hotline, or any other community-based events or programs that were not documented on an individual basis. You should also not include individuals who had only received services from large-scale events such as mass immunization programs, screening programs, or health fairs, and individuals whose only contact with your agency was to receive counseling or vouchers under the WIC program. A patient can only be included in one payment source designation listed in question 1. The patient's payment source in the application response should be the payment source designation listed for the patient at the last visit closest to the freeze date. So let's take a look at this example. For this example, the agency has chosen April 1st, 2024 as their freeze date. When taking a look at patient A, they were seen 3 times from January 1st, 2023 up until that April 1st, 2024 freeze date. They were first seen on January 20th, 2023, in which they had Medicaid as their payment source. They were seen again on December 11th, 2023, at which point in time they were uninsured. February 15th, 2024, they had Medicaid, and that is the appointment that you're going to be looking at because that appointment is the last appointment closest to the freeze date. So that patient's payment source designation in your application response would be Medicaid. Looking at patient B, they were seen twice, February 15th, 2023, and again December 15th, 2023. The December 15th, 2023 appointment is closest to that April 1st freeze date, at which point in time they were uninsured. So uninsured would be their payment source designation in the application response. So let's go back to question 1 and tie it all together. The first step was determining your freeze date. The freeze date will go in the upper portion of question 1. Please do make sure that you are entering your freeze date. That is one of the things that I find missing a lot of the time when applicant agencies submit their application. So do make sure that that piece is filled out. Also make sure that you are utilizing your freeze date correctly, meaning that you are counting patients up to your freeze date. So if your freeze date goes beyond December 31st, 2023, for example, if you've chosen February 1st, 2024, make sure that you are counting patients up to your freeze date and not just the calendar year. So that's very important that you are utilizing your freeze date correctly. So after you've completed that piece and you have determined your freeze date, you're going to pull your unduplicated patient count, and that number is going to be listed in step 1. Now we're going to begin placing your patients in buckets. So of your number in step 1 of your unduplicated patient count, how many of those patients had Medicaid? That is going to go in the second highlighted cell. Step 2B is CHP plus. So how many of those patients from your unduplicated patient count had CHP plus? Step 2C is any other reimbursement of healthcare costs by a governmental program, such as Medicare or Social Security. And step 2D is any other third-party payer not mentioned above, So that would be your private insurance. So now we have taken all of your patients and placed them in your buckets for Medicaid, CHP plus, any other reimbursement for their healthcare costs by a governmental program, and any other third-party payer not mentioned above, such as their private insurance. Step 3 is going to auto-calculate for you, and that should be your uninsured patient count. This is the number of patients who do not have any of the payment designations from step 2. Now, for step 4, you are going to take the number of the patients that are in step 3, the number of your uninsured patients, and input how many of them are at or above 200% of the federal poverty level, as outlined in the federal poverty guidelines. And keep in mind that this number should also include any of those patients whose federal poverty level you were unable to determine. So this will include patients with the FPL undetermined or unknown. Now, step 5 is going to again auto-calculate for you, and this will be the number of your uninsured patients that are below 200% of the federal poverty level. So this is your medically indigent patients, and this is the number that your grant award is based on. So we'll go through that quickly one more time. Step 1 is your unduplicated patient count. Step 2 is the payment source designation for your patients. Step 3 is your uninsured patient count. Step 4 is the number of patients that are at or above 200% of the federal poverty level from those step 3 patients. And then step 5 will auto-calculate again for you. And that is your medically indigent patient count and the number the award is based on. So the second part of question 1 is your source of data. Where were your patients from your count seen? We need your main facility as well as any satellite clinics that you might have. I know some of our agencies have numerous clinics, so if you run out of room in the application to list them all, you can create an Excel sheet and upload that to your SharePoint. We will accept that, but this is very important for you to make sure that you are listing all locations that your patients were seen. In the event of an audit, the audit team will be tying back the information that you submit to the audit team to what you filled out in the application. The next tab is the question 2 tab, which is your sliding fee schedule. We do expect a minimum of 2 sliding fee scales. Some clinics could have as many as 3 scales, and that is due to the fact that the federal poverty guideline changes in January. The important thing right here is just to remember that your sliding fee scales must cover the duration of your application. So if your freeze date is February 1st, 2024, then your sliding fee scales and co-payments should cover from January 1st, 2023 to February 1st, 2024. We do need the corresponding co-payments for each sliding fee scale. And even if your scale and co-payments do not change year to year, we still need that documentation uploaded to SharePoint. Please make sure that the effective dates are listed on your sliding fee scales so that we are able to tie your patient's appointments back to your sliding fee scales and the co-payments. The outside entity includes the criteria and requirement of your outside entity. The outside entity is required to sample a minimum of 25 patients. Providers that had financial data validation findings during the fiscal year 23-24 application were notified to increase their sample size on February 2nd, 2024. Please ensure that your outside entity is sampling patients counted to your freeze date. So again, if your freeze date is February 1st, 2024, make sure that your outside entity is counting the patients to February 1st, 2024, and not just sampling the patients for the calendar year. Confirmation by an applicant agency needs to be signed by an authorized representative, confirming that all the data and documentation submitted during the application response is accurate and true. The waiver tab, HCPF offers a waiver that allows clinics to waive answering questions 3 through 6 of the application. Agencies can use the waiver if they have been awarded funding within the previous 3 years, if they meet the eligibility criteria of a qualified provider, and if they certify that there has been no changes in the capacity to meet all eligibility requirements. The waiver does not apply if you are a brand new applicant and have not received funding through the primary care fund in the previous years, or if you have been notified to complete the entire application. And again, those notifications went out on February 2nd. Question 3 pertains to medically underserved area or population. If your agency provides service in an area that has a medically underserved area or a medically underserved population designation, you will provide the county name, designation type, service area name, and the federal ID number. If your agency provides services in an area that does not have an MUA or MUP designation, then you will provide evidence and cite sources that demonstrate that your agency serves an area or population that lacks adequate healthcare services for low-income uninsured persons. Question 4 consists of a total of 7 tabs. Those tabs are the components of primary care. So you have primary care, maternity care, preventive, developmental, and diagnostic services for infants and children, adult preventative services, diagnostic laboratory and radiology services, emergency care for minor trauma, and pharmaceutical services. Completion of question 4, so all of the 7 tabs that make up the components of primary care, should demonstrate that the applicant agency has a track record covering a consecutive 52-week period prior to the submission of the application of providing cost-effective care, and will continue to provide or arrange for comprehensive primary care services to persons of all ages on a year-round basis. This is not a new requirement and can be found in the primary care fund rules and regulations, but I do think it's important to point out what the expectations are. Agencies not providing or arranging for comprehensive primary care services to persons of all ages must have documentation that an established referral relationship is in place. An established referral relationship is a formal, written agreement in the form of a letter, a memorandum of agreement, or a contract between 2 entities that includes the comprehensive primary care and/or products to be provided by one entity on behalf of another entity, any policies, processes, or procedures, and the guarantee that the referred medically indigent patients shall receive services on a sliding fee schedule or not at no charge. The signatures by representatives of both entities are also required. So what that means is if your clinic is an age-specific clinic, so let's use a pediatric clinic, for example, and you don't see patients above the age of 18, You must have a referral relationship in place with another clinic where you can refer those patients to so that they may receive the services that you're unable to provide. The only exception here is emergency care for minor trauma. So we do not require a referral relationship to be in place with a hospital to refer patients to for emergency care for minor trauma. So again, this is very important that you have these established referral relationships in place. Moving on, question 5 and question 6. Question 5 pertains to eligibility screening. We'll need your agency's process for screening patients' eligibility for Medicaid, CHP Plus, and CICP, and also the policy for how you refer those patients potentially eligible for any of those programs to the appropriate entity. Question 6 is the Quality Assurance Program, which is a formalized plan and processes designed to ensure the delivery of quality and appropriate comprehensive primary care. This can be demonstrated by obtaining a certification or accreditation through the process administered by the Joint Commission on Accreditation of Healthcare Organizations or by the Accreditation Association for Ambulatory Healthcare. If you have either of those, then you do not need to answer the 8 questions. There's 8 questions in the question 6 tab. You do not need to answer those 8 questions. You can just submit a copy of that official documentation of the certificate or the accreditation to your provider SharePoint site. Agencies that have not received certification or accreditation through either of those entities will need to complete the 8 questions in the tab to demonstrate how all the components set forth for a quality assurance program are defined by the primary care fund are met through the applicant agency. Now we have gone through the application tab by tab. It is now time for you to submit. I do recommend coming back to your checklist and making sure that all of the tasks have been complete. Make sure that you have uploaded all your documentation to SharePoint. So your sliding fee scales, your certifications and accreditations, your outside entity, the confirmation by an applicant agency, your waiver if you're using the waiver this year, your referral relationships. So make sure that all of your documentation has been uploaded. Email the primary care fund email address that you have officially submitted your application. And again, applications are due by close of business May 24th. HCPF has a frequently asked questions section on the department's provider information website. This is very helpful. Again, if you're brand new to the primary care fund program, there's a lot of helpful information there. And also, if any of the applicant agencies have questions that they would like to see on the FAQ, you can email those to the primary care fund email address. Moving into data validation and common audit findings. Audits happen approximately every 3 years. They consist of a comprehensive review of the primary care fund application and all of your supporting documentation. Please remember to keep all documentation used to complete the application for 6 fiscal years, and those organizations that are due for the audits in the upcoming 24-25 grant cycle will be notified in the coming months. Some of the common audit findings that we come across are not counting secondary insurances, not verifying yearly income is below 200% of the federal poverty guideline, not charging the appropriate sliding fee scale copays, counting self-patients, and not keeping your documentation to support your application. So that includes your patient count, your federal poverty levels, and your charged copays. It's important to keep your documentation because the audit team will be looking at the documentation that you submitted for the application and comparing it to the documentation that you give to them at the beginning of the audit cycle. If that information is not matching, that's where a lot of your findings are going to occur. So your sliding fee scale copays should be matching up to your patient's federal poverty levels to make sure that they are being charged accordingly. Your patient count should match what you have submitted within your application. So just very important to keep your documentation to support the information that is in your application. It's also important to know where to place your patients within question 1 of the application. So what buckets to place those patients in. So I think it's important that you understand the definition of a medically indigent patient. Those are your patients whose yearly family income is below 200% of the federal poverty guideline. Those who are not eligible for Medicaid, CHP Plus, Medicare, or any other governmental reimbursement for healthcare costs, and where there is no third-party payer. To meet the qualifications of a primary care fund provider, the provider must accept all patients, regardless of their ability to pay, and use a sliding fee scale for payments or not charge the medically indigent patients at all. The sliding fee scale is a tiered co-payment system that determines the level of the patient's financial participation and guarantees that the patient is not paying above the usual and customary charges. Factors considered in establishing the tiered co-payment system should only be the financial status and the number of members in the patient's family unit. If a provider is charging patients on a self-pay rate that is outside of the provider's sliding fee scale or not at a $0 rate, those patients should not be included in your final medically indigent patient count, and they should be eliminated during the methodology process in question 1 of the primary care fund application. Women's Wellness Connection reimburses a limited set of services on a per-patient service-specific basis. Therefore, WWC patients should be categorized under Step 2C, which is any other type of reimbursement for healthcare costs by a governmental program. However, if a patient has received WWC services, but they also receive other comprehensive primary care services at that same appointment, they can be included in your clinic's uninsured count if that patient was charged a sliding fee scale copayment for the other comprehensive primary care services, and the patient services are distinctly documented in the provider's billing system. The same goes for HRSA COVID-19 uninsured program. Those patients should be categorized in 2C in question 1 of the application. However, if they received HRSA reimbursable services, but also received other comprehensive primary care services, then they can be included if they were charged a sliding fee scale copay for the other comprehensive primary care services, and those services are distinctly documented in your billing system. There are 4 parts to the Ryan White HIV/AIDS program. Part A, Part B, and Part C grant recipients can be included in your primary care's medically indigent patient count. We do require documentation supporting what part of Ryan White HIV program was received. And also you must discreetly identify what type of Ryan White fundings were received. The Last part, the fourth part of Ryan White, Part D, is associated with providing primary medical care to women, infants, children, and youth living with HIV. So Part D payments are associated with specific patients and services. So those patients seen under Part D of the Ryan White HIV/AIDS program should be categorized in Step 2C. The funding of the Primary Care Fund program. I have created a graph including the final payment numbers dating back to fiscal year 2019-20. The state cash fund is represented by the green bar. The blue is federal funds, and the gold in fiscal year 23-24 is the state general funds. As you can see, there was not much change from fiscal year 2019-20 to fiscal year 2021. Looking at fiscal year 21-22, you can see that the payments basically doubled from the previous year. So in fiscal year 2020, we were at 24.6 million. Fiscal year 21-22, we were at 51.5 million. That is because fiscal year 21-22 was the year that we were able to begin the federal match on the state cash funds for those Medicaid clinics. So we were able to basically double payments for those Medicaid clinics. Fiscal year 22-23, we did see a slight decrease going down to 47.3 million. Keeping in mind that these are the final payments, the tobacco tax revenue has something to do with that slight decrease. So as tobacco tax revenue decreases, we will see the payments decrease accordingly. The estimated award amounts for fiscal year 23-24, so the current grant cycle year that we're in now, is estimated to be at 59.1 million. So that includes a one-time grant of 7 million out of the state general funds, as well as 22.5 million in state cash funds and 29.6 million in the federal funds for those Medicaid clinics. So that $7 million one-time grant was huge for us this year, and we were able to add that into the payments over the 4 quarters. So we are happy that we were at 59.1 million. We will wait and see, of course, what the final tobacco tax revenue comes in and see how that will affect that. But right now, that is the estimated award amount for fiscal year 23-24. The state plan amendment is what allows Medicaid providers to receive state funds in addition to the federal matching funds, and that was approved on January 17th, 2024. The state funds budget appropriation for fiscal year 23-24, the current grant cycle that we're in right now, was set at $22,494,290. We're not anticipating a drastic change for fiscal year 24-25. So the state funds appropriation for fiscal year 24-25 is set at the same dollar amount as fiscal year 23-24, so that 22.4 million. The Joint Budget Committee met the week of March 4th and voted to give us a $7 million award from the state general funds. So that's very exciting for clinics. Keep in mind the numbers for fiscal year 24-25 are just estimates pending the approval of the long bill. We will continue to pay 90% of the appropriated amounts during the first 3 quarters. We do this to be more in line with the actual revenue received and to also help prevent that drastic shortfall in the 4th quarter payments. We will adjust based on need when comparing to the appropriation. And then we true up to the actual tobacco tax received in the fourth quarter payments. We do make every effort to issue quarterly payments on time. However, payments can be delayed if there's not enough tobacco tax revenue collected during each quarter. Since primary care fund is dependent on the tobacco tax revenue collected, if we do not collect enough to support the payment for any given quarter, that payment will be delayed until enough tobacco tax has been collected. I have good news on the first quarter payment. We have been late issuing that payment for the past 2 years while we waited for the approval of the spa. That is not going to be a problem anymore. You will not see that first quarter payment delayed due to the spa. We have added a little bit of verbiage that we will be posting the provider's tentative award amounts to the provider bulletin. And so I have a link here to the provider bulletin. But that first quarter payment will not be delayed due to the spa. Now, quarter four payments are almost always delayed. That's because we are reconciling the end of the fiscal year, the final tobacco tax revenue, as well as working in the audit financial findings within the audit cycle. But please know that it is never our intent to be a burden upon the clinics by issuing late payments, but sometimes it is just beyond our control. Few application reminders. The intent to apply is due Friday, April 12th. The application response is due by close of business on Friday, May 24th. Tentative award notifications will go out on Monday, July 8th. Again, here is the link to the primary care fund email address to submit your intent to apply and your application response, as well as any questions that you have throughout filling out the application. And my contact information, you can reach me by emailing the primary care fund email address. And here is a link to the provider information page on HCPF's website. A lot of good information there, as well as the FAQ that I went over earlier in the presentation. I thank you all for tuning in for the presentation. I look forward to working with you all in the upcoming year, and please feel free to reach out should you have any questions. Thank you.